according to the Catholic standpoint, no one has the authority to take any other person's life or to inflict pain or harm any other person. Having explained all these three terms of euthanasia, dysthanasia, and orthothanasia, I would like to use a simple case to demonstrate the ethical and moral implication of this term according to the Catholic moral theology. Okay, for instance, somebody is sick and the person has been sent to the hospital. Let's say during the checkups, it was discovered that the person was diagnosed with hemorrhage secondary to aneurysm of a cerebral artery, and afterwards developed cerebral meningitis. You know, cerebral meningitis is common in Ghana, here, especially in the northern parts of Ghana. And because of that, the person becomes semi-comatose, undergoing tracheostomy and gastrostomy, and has not spoken or communicated to anybody and will not even move his hands or have any eye contact. And as time goes on, this person is subjected to respiratory infections, and at the end develop edema. So the question is, in this case, should we discontinue or the treatment and let the person die a good death, or should we continue? Now, we look at the terms we use over here, and we try a little bit to explain it so that you see the background of the whole sickness of this person. There is a clear picture of an aneurysm of cerebral artery or vein which causes localized dilation or ballooning of the blood vessel. So if they say aneurysm is something which happened to the cerebral artery, which causes the ballooning of the blood vessels, and a cerebral meningitis is a serious disease in which the tissue enclosing the brain and spinal cord becomes infected and swollen. So the person is having all this and become comatose. Comatose means is in a deep unconscious state, usually lasting for many weeks, months, or years, and has caused a severe injury or illness. Tracheotomy is a medical operation by cutting a hole in the trachea to help respiration, to help the person to breathe. That is to enhance his respiration. So that medical method is done. And gastrostomy is an opening in the stomach to provide needed nutrition. So when you go to the hospital, you see those things. Sometimes they have to put a pipe somewhere on the stomach of the person to feed the person from there. So this person is having all these problems and at the end develop edema.